We have a round 2. We made a lot of progress on the first round in terms of feminization, bringing in the waist, expanding the hips. On this round, we're going to further enhance the hips, create more of a flare. Additionally, we're going to re-lipo the waistline with rib remodeling, which should give us an average of 2 to 3 inches, sometimes more on the waistline. Round 2, so we're going to re-lipo the whole upper torso, waist, come in on the waistline, re-expand the thighs to improve the waist to hip ratio. Additionally, we're going to do rib remodeling, ribs 12, 11, 10, and 9. Those are the floating and false ribs. The rib remodeling really overcomes the limits of lipo, meaning if you lipo down to bone, there's nothing else you can do. By really infracturing the bone, you get another 2 to 3 inches on the waistline on average, sometimes more. Every time you touch, I get butterflies. Every time you close, I lose it in your eyes. Would it be too much if we do it again? Do it again, let's do it Let's do it again. Finished doing our lipo with rib remodeling. You can see nice improvement in the waistline, specifically where you see these markings. These are the 4 ribs that we remodeled or infractured. You can see nice improvement in the hips, gradual transition into the waist, and improved waist to hip ratio. Before doing any rib procedure, we always get a CT scan. So this is a CT scan with 3D reconstructions. We count how many ribs there are. There's 12 ribs. One of our patients had 11. Then we measure out kind of where the angulation starts to really bend on the rib. So somewhere around here is the angulation, and we measure it out. It's about 8 to 10 centimeters. So this is around 8, this is around 10. And this is something, so when you break the bone, it's a monocortical fracture, meaning just the upper part's broken, but the part on the bottom is still intact. So it creates an angulation. When you heal, if you don't wear the garment, it's going to go back to this, right, straight. What you want to do is heal while the bone is angulated. That angulation is what allows, the angulation right here to bring in is what allows the waistline to narrow. That angulation is maintained by wearing the corset. So we brought in the waist. You can see nice improvement in the waist to hip ratio. Yes. This is mostly from the rib remodeling, less from the lipo, since it's around 2 lipo. So when she heals up, she's going to have an awesome waistline and expanded thighs. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.